A new campaign is highlighting how HIV is disproportionately impacting Black women here in Ontario. Our City News reporter Faiza Amin has more on the movement to normalize positive conversations around those impacted by the virus.
We invited some of our sisters living with HIV to come talk openly about how they learn their status early, access treatment safely, and the fact they're living long, healthy, beautiful lives. But not one of them felt safe showing up and talking publicly.
This video is part of the Positive Conversations campaign to end stigma against those with HIV, normalizing conversations about HIV and HIV testing. It's being led by and for a community that's disproportionately impacted by the virus.
African, Black, and Caribbean communities represent less than 5% of the overall Ontario population, but represent, over 25% of new diagnoses. So that's alarming.
Another alarming stat, according to the African and Caribbean Council on HIV/AIDS in Ontario, over 3 in 5 of all women in the province who test positive for HIV are Black.
There's a real disconnect. The numbers don't add up.
And they say that number is increasing. The disproportionate impacts are said to be caused by a number of factors, many of which are social determinants of health.
How you're employed, how gainfully you're employed, access to early childhood education, access to housing, there are a number of social determinants of health, and including anti-Black racism, and including social exclusion.
Central to the campaign launched by ACHO and the CARE Collective this month are the voices of people in the community. Out of that conversation, how stigma creates barriers and vulnerabilities.
It is particularly deadly, if I can use that word, very serious, right? So if you're feeling discriminated against, if you're excluded, it just means that all the things that one should do, testing regularly for HIV, knowing your status, accessing treatment.
According to ACHO, Black Ontarians are less likely than those of other groups to know their HIV status and receive treatment. They say if the stigma is tackled, change will happen with knowledge, early testing, and access to resources.
There's still a lot of stigma around HIV. And there's a lot of fear around living with HIV. The stereotypes and the ideas we had 10, 15, 20 years ago haven't evolved to meet where we are today in terms of treatment. So people do not understand that you can actually live a long, a healthy, a beautiful life, even if you're HIV positive.
For City News, I'm Faiza Amin.